you explain a little bit more about those three factors specifically?
So diabetes itself is also an inflammatory condition. So what happens initially is insulin resistance. So it also leads to the deposition of fat inside the muscle.
Right.
So muscle cannot take up glucose, and glucose actually builds up in the blood, and that causes a decrease in flow of the blood as well as inflammation. And as we talked, arteries which are inflamed are more prone to atherosclerosis.
It seems like you keep using the word inflammatory, inflammation. That seems to be a key when it comes to P.A.D. Is that correct?
It does, because I think obesity, which we don't pay enough attention to today, is because we don't think about it. We think it's just fat, but it's not just fat. It's a pro-inflammatory state of the body. So if we start thinking more about that in those terms, then maybe we'll start focusing on it more.
We talked about weight. Now, what about age? Is age a factor when it comes to atherosclerosis, P.A.D.?
So age is also a big risk factor for peripheral arterial disease, but I think it's all related to the insults that have happened over the year to your body.
Okay.
More so.
Now, but when you have patients that you see, are they mostly in a certain age category? Do you see them younger, older?
So usually older patients.
Okay.
So patients, according to the latest data, people who are older than 60, around 12 to 20% of them have P.A.D, and more so if they are diabetic and smoker.
Okay, and what about gender? We always hear that sometimes women are more at risk for heart disease than men. It's one of the number one killer for women. So explain that. Does this affect women more than men?
So it was initially thought P.A.D maybe affects men more.
Right.
But now we see it affects men and women equally. And but there's some race-based differences. Like in African Americans, P.A.D is actually more common.